A very good morning to all of you. In continuation with our third chapter, so now we are going to discuss about reality therapy. This particular psychotherapeutic technique is also considered as a cognitive approach which works on our thinking, our perception, the way we interpret and the way we perceive either future or past events. The basic two objectives of this particular therapy is to help people or client get connected or reconnected with the people which they have chosen in their quality world. Important term in reality therapy is quality world. We all have our own world. We all have our own qualitative world also. So what exactly it is? So that we are going to study further. And second objective is to learn, to understand, adapt some more better ways of fulfilling all of our needs, especially to fulfill psychological needs. This particular therapeutic technique, it is designed, coined by William Glasser. The name is important for MCQ purpose. Reality, rather than thinking about past and even unnecessary thinking about future, it is always important, better and practical also to think and to work on our present. So the term is there, reality, what is in real. We cannot change what has already occurred to us, and even we are not sure also that what exactly we are what exactly is going to happen with us. And so William Glasser, he used to say that client should not be labeled with a particular diagnosis. He was quite against of using the words as depressed, anxious, tense, stress or so. Rather, he used two terms like depressing, headaching, angering, anxieting also. So ing form in the present form. And so it is also called as choice therapy. Earlier it was called as control theory also. Choice theory means exactly what? It is like problem is based on chosen behavior. Similar with existential approach, freedom and responsibility. So here a problem, an issue or the thing through which we are suffering, it is based on our chosen behavior. We are responsible for it. So this particular theory, it gives us explanation of why and how we function. का बरं तसं झालं, मग कशामुळे झालं आणि का असं होतंय, काय करायला पाहिजे त्याच्यावरती. We do have a choice. So second important term, it is quality world. So quality world in the sense like we do not satisfy our needs directly, but some of the times or many of the times, according to William Glasser, we satisfy our needs indirectly through imagination, even visualization. मग काही वेळेस त्याला डे ड्रीमिंग पण आपण म्हणू शकतो, और विशफुल थिंकिंग, आई विश के अगर ऐसा होता तो, like that. The quality world in the sense the world which we would like to live in if we would. जर असं झालं असतं तर, जर मला असं करता आलं असतं तर, जर मी हे केलं तर, आय विश की अशा गोष्टी आणखीन 2 वर्ष आधी झाल्या असत्या तर, आय विश की अशा गोष्टी नंतर झाल्या तर, वगैरे वगैरे. आर क्वालिटी. This particular our world, it is based on our needs, wants, which are quite specific, selected, structured, constructed, like people, activities, events, beliefs, possessions, and even situations which fulfill our needs. Everything it comes under our quality world. In this world, there is another term which he coined called as picture album. हमारे लाइफ का एल्बम कैसे होता है और कैसे होना चाहिए जो हमें लगता है. It is like art of therapy. That means getting into the client's quality world. As a counselor, as a therapist, we should know, we should be able to understand that what exactly the client is feeling, what exactly the client is wishful for some particular people, some particular beliefs, some particular events or situations or anything. And so again, here also, building a rapport, establishing a meaningful and qualitative relationship with client, it is most important. Then only we can step into the quality world of client. Furthermore, in addition to Glasser, another key person in reality therapy is Woboldi. He added the term called as WDEP. So his system kaya hai, and again for MCQ purpose also it is also important. So let's see. To have again the outline or the gist of reality therapy or the crux of this particular technique is, it is the approach to counseling or therapeutic session which is aimed on the here and now approach. Reality जो हुआ है वो हुआ है, जो होगा वो तब होगा, but अभी हम क्या कर सकते हैं? Let's accept the fact as it is. Here and now approach, and so that it will be help them to create a better future. The more we are able to accept the reality, the more we are able to face it. And the more we are ready to face it, then only it will be helpful to deal in future also. And that's why reality therapy emphasizes making assumption, emphasizes in making decisions and taking action and control of one's own life. We are responsible for our lives. This is also the reality. Rather than blaming others or situations or any other reason, it's better to accept and take charge of our life. So here, a typical, the client seeks to discover what they really want and whatever what they are currently doing. What exactly they are doing right now and what exactly they are seeking. Similar to Roger's real and ideal self. This therapy, it helps them to have clear understanding. Is there any kind of discrepancy between what they want and whether what they are currently doing is actually bringing them nearer to or further away from that particular goal? The goal which they have set, is it so that their thinking, feeling, actions or behavior are supported to achieve that particular goal? Or is it so that they are thinking in something way and their actions are in totally opposite way? Reality therapy helps us a lot because it focuses on facilitating the client to become aware of, and if it is necessary, to change his or her thoughts and even actions. So these 5 features or 5 particular characteristics of reality therapy are: the first one is it emphasizes choice and responsibility. We do have a choice, and yes, we must take the responsibility of it. The key functions similar in existential therapy or logotherapy, which we have discussed. Second one is rejecting the transference, similar to Freud's approach. Transference, counter transference. म्हणजे क्लायंट मध्येच आपल्याला आपला भाऊ बहीण पार्टनर वगैरे कोणी दिसतात, or sometimes even client also perceive us in some different way, but ideally therapist immediately they should make them aware about the real relationship, real professional relationship as client and as a counselor. Third thing is keep the therapy in the present. In Rogerian approach, it is called as immediacy, right now, here and now. Fourth point, already we have discussed, avoid focusing on symptoms. So instead of labeling them as depressed, anxious or so, it's better to focus on the current behavior. And challenge, William Glasser, he has challenged DSM's views also of mental illness. So when we are talking about emphasizing choice and responsibilities, according to him, clients are responsible for what they do, even in past, in present, and even in future also. Right now, what we can do, the choice is with us. If we choose all we do, we must be responsible for what we choose. Particularly, reality therapists, they deal with people as if they have choices, assuming and having a thought that yes, clients, they do have choice in all circumstances, even in the negative or the worst cases. They do have a choice, how to think, how to perceive, how to react, how to respond, or to remain silent. Therapists, they should focus on those areas where clients have choice. In the sense, therapists should focus on the strengths, potentials, abilities of client. For doing so, it gets them closer to the people which they need. So what exactly they are looking for. As client begin to feel good about it, then there is less necessary for them to continue to choose that particular ineffective and self-destructive behavior. The most important fundamental part for reality therapy and therapist is to deal with transference. However, Freud has focused only on the relationship, and so the term was there, transference and counter transference. Sometimes during the session, it may happen that all of a sudden in a flow, the client may say कि सर आपको देख के मुझे मेरे भाई की याद आ गई, आप उन्हीं की तरह बातें करते हो और but a true therapist and a true counselor should immediately, instantly, he should say that, or he should reply, he should make the client aware that I'm not your mother, father, or anyone else, but I am myself. I am your therapist. One of the additional part of reality therapy is rejecting transference, in the sense, instead of remaining past, instead of focusing too much on the things which has already occurred, therapist here says to client that what has happened is over. It can't be changed. Even if it is too much close to our heart or mind or any other thing, even if it is so right or wrong, justice, injustice or anything, but we can't change. The more time we spend looking back, the more we avoid looking forward. So it's better to see the things really that yes, it has been happened, it has been occurred, now it's over. And so in even daily life also, we should learn to let go the things. हुआ है वो हो चुका है. It's better to move ahead. This is the core part of reality therapy. And additionally, it's Golding's WDEP system, a technique or strategy which assists clients in satisfying and exploring. Not only satisfying, but even it helps challenges the client to explore their basic psychological needs, basic fundamental needs. WDEP stands for W stands for want. So what exactly do you want? If you were the person that you wish you were, what kind of person would you be? Do you really want to change your life? What is it you want that you don't seem to be getting from life? And what do you think stops you from making the changes you would like? What kind of clarity you want from your life? D stands for doing and direction. That means it is easy to see and impossible to deny, but it serves as the proper focus in therapy. Does your current behavior have a reasonable chance of getting you what you want now? In terms of student perspective, a student may say that I want 80% in my degree, in my PG degree also. It is a want for that particular student. Okay, fair enough. Is the current behavior, the current pattern and style of studying, the way he manage his time, the way he make notes, and the way he discuss with his teachers, friends, or anybody else, is it really helping them to achieve what exactly he want, or is it so his wants are different and his directions are different? In Marathi also it says that अचूक दिशेनं प्रयत्न करणं हे फार महत्वाचं आहे. तर आपल्याला जे हवं आहे ते मिळतं. So we should always introspect ourselves that whether our doing and our directions are really helping us or not. The third and most important thing is planning and action. So what exactly we are doing? How can we see for ourselves now and even in future? A proverb says that if you fail to plan, you plan to fail. So planning irrespective of any task, apart from studying or even financial or any other thing, planning it is most important. The therapy session should be in such a way, the dialogue, the questioning, the body language, everything it should be in such a way so that the client should be motivated. He should have that kind of insight that yes, how should I plan now reality? And what kind of action I should take so that my planning it will be implemented in a more constructive way and in a more appropriate way. And the last thing is evaluation of self. It can be also considered as monitoring self. So whether I have achieved my goal which I have set for myself or not. Evaluation of self, it is most important, and here also therapist expert matters a lot. Interaction with expert, interaction with that counselor, it is important. And in brief, reality therapy also spoke about these 5 genetically encoded needs. The first one, which we all are experiencing severely even and now, called as survival need. It is genetically encoded. It is with us right from day one. Survival need. Second thing, genetically encoded is love and belongingness. To love and to be loved. आपण प्रेम करावं आणि आपल्यावर प्रेम करावं ही मानसिक महत्वाची अशी गरज आहे. And again, love is having a broader sense. The third thing is need, rather it is power or achievement need. Need of power. Fourth one is about freedom and independence. Freedom or independence. Psychological freedom, it is most important. We may be dependent physically or outwardly. We may be dependent. But a need is like we want autonomy, psychological point of view, our own perception, our own planning, our own motivation, our own direction, our choice of perception. It is important. And fifth one is about fun. The enjoyment, happiness, enthusiasm, satisfaction, feeling of contentment, most important. So reality therapy, it works like this. This is how in brief we have discussed about reality therapy. In next session we will discuss about remaining points of third chapter. Thank you so much.